Dengue fever, a disease that echoes through tropical landscapes, often called breakbone fever because of the excruciating pain it inflicts, is a viral illness causing intense muscle and joint pain, making even simple movements a challenge. It's a condition that can truly debilitate. It's spread by mosquitoes, those tiny vectors that carry the virus from one person to another. It is a growing threat in tropical and subtropical regions, where warm climates and standing water create ideal breeding grounds for these disease-carrying insects. There are 4 distinct types of dengue virus, each with its own unique characteristics. Getting infected once doesn't protect you from the others, meaning you can contract dengue fever multiple times throughout your life. Repeat infections can be more dangerous, potentially leading to more severe complications. Dengue cases have surged worldwide due to a complex interplay of factors, including urbanization, with more people living in close proximity, creating more opportunities for the virus to spread. Travel, allowing the virus to hitchhike across continents and establish itself in new regions, and climate change, which is expanding mosquito habitats and prolonging transmission seasons. The disease isn't spread person to person through casual contact, so you can't catch it by shaking hands or being near someone who is infected. It is transmitted exclusively through the bite of an infected mosquito, acting as a bridge between hosts. This means prevention focuses on controlling mosquito populations and reducing their ability to breed and spread the virus. Prevention also means avoiding bites through the use of repellents and protective clothing. Understanding how dengue spreads empowers us to take action and protect ourselves and our communities. Let's look at how the virus makes its journey from mosquito to human and what happens when it enters our bodies. Dengue fever, a viral infection, is mainly spread through the bite of infected mosquitoes. It's crucial to understand how this transmission occurs to effectively prevent its spread. The primary culprit is the Aedes aegypti mosquito, easily identifiable by its distinctive black and white markings, which has a preference for biting during the day, making daytime protection essential. These mosquitoes become carriers when they pick up the dengue virus from an already infected person during a blood meal. After the mosquito ingests the virus, there's an incubation period of about a week, after which it can transmit the virus to other individuals through its bite. A single infected mosquito can potentially infect numerous people throughout its lifespan, fueling rapid outbreaks, especially in densely populated and crowded urban areas where human-mosquito contact is frequent. They thrive particularly well in urban environments, adapting to the conditions that cities provide. These mosquitoes breed in even the smallest amounts of clean, standing water, a characteristic that makes them particularly challenging to control. Consider common items like flower pots, discarded buckets, or even something as small as discarded bottle caps. Even a tiny puddle, seemingly insignificant, can quickly become a breeding ground for these mosquitoes. Because these mosquitoes typically live in close proximity to people, often right in our own backyards, outbreaks can escalate with alarming speed, spreading rapidly through a community. Preventing dengue starts with a proactive approach, primarily focusing on eliminating their breeding sites. Here's how you can take simple yet effective steps to protect not only your home, but also contribute to the safety and well-being of your entire community. The best defense against dengue and other mosquito-borne illnesses is stopping mosquitoes before they even have a chance to start breeding. This proactive approach is far more effective than dealing with a full-blown infestation. Check your home and surrounding property weekly. Pay close attention for any sources of standing water, no matter how small. Empty, thoroughly clean, or securely cover any containers like buckets, plant trays, and pet bowls. Remember, mosquitoes can breed in even the smallest amount of water. When outdoors, wear long sleeves and pants, especially during peak mosquito activity times, like early morning and late afternoon. These are the times when mosquitoes are most active and looking for a meal. Consistently use insect repellent on any exposed skin, and ensure that all window and door screens are in good repair to prevent mosquitoes from entering your home. If possible, use air conditioning indoors. Consider using bed nets, especially for vulnerable populations like children and the elderly, who may be more susceptible to mosquito bites. Talk to your neighbors and organize regular community cleanups to collectively remove potential mosquito breeding sites from your shared environment. While fogging can provide temporary relief during outbreaks, it's important to remember that it's only a short-term fix and doesn't address the root cause. Long-term safety and well-being comes from everyone working together consistently to reduce and eliminate mosquito habitats in our communities. Ultimately, prevention is a shared responsibility that requires ongoing effort and collaboration. Dengue often starts suddenly with a high fever, severe headache, pain behind the eyes, and intense joint and muscle pain. Other symptoms include rash, nausea, and vomiting. If you notice these signs, especially after travel to a dengue area, see a doctor immediately. Early diagnosis is crucial. Severe dengue can develop quickly. Rest, stay hydrated, and use only acetaminophen for pain. Avoid ibuprofen and aspirin. Watch for warning signs like severe abdominal pain, persistent vomiting, bleeding, or extreme fatigue. If these appear, seek emergency care right away. Quick action can save lives. Know the symptoms and don't wait to get help.